Hello everyone, and welcome to the another audio podcast on the fourth series around topic around an important topic and focus around science, healthcare, and research, or health service research. And this is the Shientist, and this series, this series 4, is on in and around the LabZtorm impact, and this is Rudimentary Storm, the Immunocomplexities of Calibrations. And I'm going to dive in with some like the previous some of the previous audios or podcasts. I dived in with a bit of introduction and then a bit of understanding around the focus of what's going to be discussed, sort of the crux of what's going to be the focus and pinpoint, and then I'm going to talk about in this audio and podcast about sort of a bit more around healthcare and education, and also highlight a bit of context about the sort of healthcare scientists and what they do, and sort of the skill set or skill set mix that they have, some focus around sort of barriers to integration, and how there are sort of disparities in that regard. Then rather than bringing this all into an overall discussion, I would probably be highlighting this context in around sort of a critical analysis, and then I will highlight some resources for listeners to check out at their own time. And just to highlight, sorry listeners, that there's been a bit of a delay from the first audio podcast that came out in this series, or series 4. There's been quite a bit of sort of context that needed to come into play with what I'm going to be talking about today, but also the work has been sort of never-ending and just ongoing. And as always, and as you should know by now, the Shientist is all about bringing some of that forefront understanding from behind healthcare practices around in and around science. This is yet another Ztorm Lobostics production. So to begin with, a bit of introduction then. So so again, sorry, before I start the introduction, this again is around, it's called Rudimentary Storm, the Immunocomplexities of Calibrations, and we will be talking a little bit about some of the in laboratory practice, a little bit about aspects around calibrations and sort of quality controls, and aspects around automation for certain laboratory practices. So let's begin. So healthcare and sort of automation have at least from laboratory practice have been kind of developing and advancing over the years, if not decades, and in line with that, and the experience that scientists build their practices around have also been sort of intertwined with the day-to-day routine practices, thus to ensure that they are continuously reflecting, continuously professionally developing, and also find new ways or novel ways into actually bringing out or disseminating certain amounts of information or context that is pivotal and actually should be privy to public health and the general public. Whilst that's the case, and has been the case for several years, there is this sense that things have been quite sort of routine and automated. It's kind of an operative word in this context, because the equipment, the laboratory equipment that is used, does actually allow so for example, tests that are requested on behalf of patients, and those who might be inpatients or outpatients in hospital settings, or in the community, for example. Whilst the laboratory equipment and automated processes allow sort of good volume of throughput based on requests, which is I mean, for all intents and purposes, it's fantastic to see that. Unfortunately, the name sort of gives it away. It's either it becomes quite routine, or it can become quite automated, thus to the actual scientists in practices, and sort of often either neglected as healthcare professionals, or themselves neglect areas of practice where they can see advances, but sort of are for all intents and purposes have often been concerned with sort of their own budgets and aspects around finances, and that's to be understood in one way or another. But suffice to say that it is about a scientist being novel in their thinking, as well as those sort of to break up the day-to-day routine in some way, and that is to say, with the main current challenges faced by the NHS, or National Health Services, in the UK, for example, being that costs and the declining numbers of sort of general practitioners, for example, and even other frontline healthcare professionals, like nurses, as well. There is a demand to better utilize or sort of involve healthcare professionals, or allied healthcare professionals from different areas of specialisms. Expanding on this, though, is also to say that it's also important to take note that when thinking about how novelty can be built into practices, it is about sort of I mean, dare I say it, that you bring sort of not worry or be overly concerned about the budgets and things like that. Actually use the time to go out into communal settings, or in community, and actually from the understanding that we have, that scientists have, for example, actually bring that out as to how we do tests and how tests and investigations are composed, even context that comes from sort of standard operating procedures and sort of day-to-day testings, tests and investigations, those kinds of things. It is important, really, for such healthcare professionals to also bring that out into the community and provide that understanding to those in community who might be sort of having may have challenges accessing appropriate information, context, and actually understanding around what sort of tests and investigations sort of take place. So, for example, we know that there's areas in pathology, for example, there's focuses around sort of hematology, the blood sciences. Blood sciences encompasses sort of three main focuses, really. There's hematology, there's transfusion, and there's biochemistry. There's disciplines such as virology, bacteriology that fall under microbiology, and then there's focuses around genetics, and there's focuses around genetics. Genetics falls into is part of subdivisions as well. For example, you can have serology, you can have immunogenetics, you can have other areas, also histocompatibility and tissue typing as well. So the point is, there's lots of different focuses that healthcare professionals behind the scenes kind of have privy understanding around, and actually for several years, certainly in the UK, if not elsewhere, there is this understanding where when it comes to providing an understanding, that should actually come from frontline healthcare professionals to eventually to the patients who come through the hospital settings, for example, and hospital environs. Now the thing about this is that and what's really quite intriguing is that when there's frontline healthcare professionals providing that understanding, also it's important to know that there's limitations around that as well. Albeit I mentioned, for example, that there's declining numbers of, for example, general practitioners and nurses, and that's been highlighted in the NHS long-term in a document or framework titled the NHS Long-Term Plan, which was 2019, I believe, and basically, apart from that, there is this sort of understanding or at least this default position where basically frontline health professionals are the only ones who can provide understanding and sort of educational resource, etc. When at the same time, and I've mentioned it in a previous audio or podcast, as as listeners may well know, that the healthcare professionals themselves on the front line normally would have to access evidence-based understanding from sort of literature out there, but also rely on the sciences, the science profession or healthcare sciences, for example, who kind of more often than not contribute through providing tests and investigations and understanding around those in sort of through, for example, multidisciplinary team efforts, those health professionals are normally sort of the first and foremost health professionals who look to access understanding or gain understanding around evidence base, so that patients get the appropriate understanding from the health professionals who treat them on the front line, for example, from the front line. But that being said, where I'm getting at from here, dear listeners, is basically saying that there's these health professionals who have have that understanding, and at the same time, because the way laboratory practices are, they can't often separate themselves, obviously, to either to separate themselves to provide understanding to the general public, although in areas of in community, for example, because there can be a short there's where staffing is a problem or can be problematic. They're often doing a lot more to cover and ensuring patient care is really at the top of its is of quality and best practice, so that basically, in a way, and dare I say this, that healthcare professionals on the front line look good because of health professionals who are basically continuously battling and kind of almost in war in the laboratory practices to ensure that patients really do get sort of the understanding and sort of the tests and investigations fall within the appropriate reference numbers, and so expanding data collection surrounding different sort of healthcare conditions can in this way be helpful as well. It can help understand not only of which patients are more suspect or high risk of specific health conditions, but also allow opportunity for allied health professionals with sort of that knowledge base and understanding and even expertise to also be involved at really in areas of frontline of healthcare. So data integration, and so what I mean by data integration is that the evidence that is collated, from healthcare scientists in forms of and how they present dialogue and understanding, and not just, for example, where there might be, for example, where automated laboratory equipment might need servicing, or might need an engineer to come out and check a faulty issue on such equipment, and where updates are made, updates that need to be made are reflected in standard operating procedures. Actually, sort of that integrative sort of effort would be better or smarter, at least, if healthcare scientists could kind of separate their day a little bit, so that they can sort of get to bring areas of their practice into a way of presenting certain findings around tests and investigations, etc. Through collaborative efforts with colleagues who might be on the front line, and have that in context by way of, for example, evidenced in certain publications, for example, or working so that they can work on publications so that they can present that understanding to those who would find it challenging to access resource, i.e., those within the general public. So having that integration, or having that sort of collaborative or integrative kind of mindset from the beginning, is where scientists they have a lot of understanding, but what's impinging on that is actually, unfortunately, is time, and obviously, with laboratory practices nowadays, apart from the complexities, and I'm going to use the word immunocomplexities, and sort of the calibrations that go on, etc. That really is, a sort of a rudimentary storm always, happening sort of within laboratory practices, because there's where tests and investigations, and where patients require results either way, whether positive or negative. The laboratory practices are actually 24/7, and so scientists generally they don't really find much time to for themselves, and they don't really actually have sort of that focus, which really should be could be smarter, and which could be more collaborative as well, and that's where advancement advances have been made, but the productivity, the healthcare professionals from that context, the healthcare scientists themselves, their productivity and performance is pinpointed and sort of isolated to focus around laboratory practices, first and foremost, and ultimately, because, and this must be emphasized, that they care too much, actually, for patients out there, and that is really their limitation, in one way or another. And then apart from this, they want to their focuses are about ensuring there is there's minimal errors, or they want to ensure there's they can reduce errors and increase patient reported outcomes as well. And by the by, these analyzers, or automated analyzers, they're fantastic equipment to use, and they have sort of interfaces that are touch screen, etc., etc. It's like getting into maybe, like, dare I say it, almost like getting into a Bugatti Veyron, and basically just touch screen, and then the car starts, and then you're at 1,000,000 miles an hour. But the equipment basically has been or the automated laboratory equipment has been designed in such a way that allows, throughput. And it's different to obviously in today's world, we know that, for example, there are apps that do pretty much everything. But I'll tell you now, in laboratory practices, they don't have apps that can do what the scientists can do. So technology is I mean, technology is kind of a is quite of a from a laboratory practice perspective, is quite a dangerous word to be thrown around, because what happens in laboratory practices is that it's the camaraderie and the team efforts that take place, that is where sort of the evidence is collated through understanding of, for example, standard operating procedures, albeit they can be quite dull and mundane. However, because of the expertise that is kind of picked up through understanding of these practices, that allows professionals in the healthcare sciences and science backgrounds to actually really focus in on ensuring certain tests, investigations, and the quality that surrounds them are actually where they need to be in relating to streamlining efficiencies and improving sort of that workflow, and ensuring again that patients really do get the best out of their healthcare, because at times actually health professionals on the front line, whether nurses or doctors or other health professionals, it's really where they have it. I'm going to say they have it easier in one way or another. And once their day is done, for example, it's like the mindset is, well, they've done their bit. Let someone else do what they need to do. Otherwise, it's basically no one else really else cares anyway. That's kind of their mindset. And if you look at the workflow between health professionals in the front line versus those allied health professionals behind the scenes, for example, you can see that, for example, there's 24-hour on the one side, and on the other side it might look like 24-hour, but actually there's not that 24-hour side, and so this is something that sort of should be understood, and there can be different sort of interplay into how all of that comes about. And there are papers by there's another document actually by the Department of Health in 2012, and there is a framework that was published by in 2010 relating to liberating the NHS or National Health Service, and it talks about just some of these things. Now, the other thing I want to focus on is that with today's practices from a laboratory perspective, and again, apart from the sort of calibrations, the sort of quality sort of internal quality controls and quality assurances and external quality controls, and the things that have to sort of happen to ensure that sort of all equipment is in check, etc., and falls within the appropriate sort of a quality assurance sort of modality. Then apart from all of that, we now see that, for example, there's on every computer or every desktop, pretty much, apart from the fact that over the past 18 months to 2 years, for example, there was this mass testing investigations around COVID-19, and different sort of approaches were into focused around that because of sort of the focus because of wherein, for example, the Department of Health and Social Care had sort of prompted that to ensure that sort of the UK or the nation generally sort of would not be sort of compromised by having this infection of COVID-19. Now, that being said, there was this with everyone working sort of remotely and sort of doing things through working in sort of around areas and practices that they may not have been used to, for example, then you can see why that there is pretty much on every desktop everywhere, whether sort of in sort of sort of whether in a whether in a GP practice, whether in a hospital consultation room, or in in around pharmacy practices, or in sort of other spaces, etc., etc. Even in laboratories, every desktop has what they call, and you'll know, listeners, I'm sure, of facilities where such as Zoom or MS Teams. So every desktop has those facilities. So and I'm not going to be too bold in saying this, but basically, where there are those facilities, for example, and trying to identify routes to getting patients involved, patients and public, and even those laboratory scientists involved in providing educational support, for example, it's not too challenging to implement that. I would not, at least I don't think. And so the capability is sort of the capabilities, and even I think the capabilities and the sort of capacity to do that is out there, but it's the rigor and the integrity is so intense around ensuring best practice and ensuring that there is no compromise in patient care and patient safety on where for example test investigation results are required in timely phases on the front line, that actually patients when these other possibilities are out there, that's where there is a little bit of a sort of a kind of not there's kind of different lines in thinking, and that's where scientists themselves have in one way or another have become numb to the fact that they whether they can or can't do it, or should not do it, and there's other obvious reasons for this as well, by the way, dear listeners, because there are professional bodies or organizations that such scientists are sort of governed by, and for example, ensuring that there is no there is no sort of backlash from understanding from compromising their own practices, and some organizations should should have, for example, insurance for health professionals in that context, but they don't often for areas around educational perspectives, scientists are not covered, for example, and I say that quite loosely, they're not covered to provide understanding, because educational or understanding to the general public in one way or another, because the professional bodies, organizations, for example, do not configure that as part of their the scientist's remit in healthcare, which is pretty damning, I think. And the other thing is, so where there are insurances and covers of in relating to indemnity, the scientists is more specific to in and around first and foremost laboratory practices. So so this is where that there has been the sort of discrepancies, and unfortunately health professionals have sort of have lost sort of battles and wars when there are various ways that patients can in how the workforce can become more empowering, but because of these these remits that have to be aligned to, it makes that effort extra that more challenging. But published work by I've mentioned the organization on a few podcasts and audios and podcasts previously, by the from the Renal Patient Support Group, or the RPSG, and the work by Mohammed in 2020 actually explores if now is the right time for healthcare scientists to sort of be around to help understand certain areas of tests and investigations, to preclude or prevent misinformation to the general public. And we now know, for example, there's been kind of overzealous understanding around COVID-19, from the media, but at the same time that when there is when the media give information or provide context is fragmented, or can be fragmented, and that can cause a stir with patients and the general public, and so therefore it makes perfect sense, really, to have other health professionals kind of coming into play to actually provide clarity where that is happening. So that then potentially gives rise to more patient sort of give rise to more patient involvement, and also choice in some way or another, whereby patients can access health professionals in different ways. And I am going to say, in laboratory practices, like I've said, everywhere else, that there's on desktops generally there's those facilities, such as MS Teams, but there's also things like access to Zoom through the internet, and etc. etc. Now what I'm getting at is that for particular areas of healthcare sciences, it would make sense to have scientists at various grades to actually be on sort of MS Teams or Zoom type calls, where they can do that, provide that context to patients or professionals, with, for example, let's say there is I mean, if they have the expertise, then they can do that. They should be able to do that and document that information as part of their continuous professional development, for example, or in relating to that, that if they need if they're looking to provide understanding to patients and the public, or those, for example, in certain as inpatients, for example, in hospital settings, that actually it makes sense to have a consultant around on that MS Teams or Zoom call. So, for example, in areas of immunogenetics, in areas of histocompatibility testing, for example, there could be a scientist who can provide that understanding there, and have a clinician, sort of a consultant, or a registrar, to actually provide, to be there to ensure that the appropriate information is there. And I'm going to give the example, like, for example, in med school, they have what they call OSCEs, which are like, at least in the UK, in med schools, they have these consultation type scenarios, case scenarios, where there's cases that are read out, or have to be understood, and from those cases, the med student, or the student who's providing that understanding, they're sort of tested, and they have a health professional sort of overseeing them to ensure that they are given the correct understanding. And that is really all what quality assurance is about. And from an educational stance or perspective, that would make sense. So moving on, and I'm gonna delve into a focus now on sort of that very focus around around healthcare education, but again providing the perspective on sort of chronic kidney disease, because I think that's quite a good one to use. So several papers related to the care of patients with long-term conditions or chronic kidney disease have been published, retrospectively, and to name a few, papers by Bryan et al. In 2014. There's a paper by Chaudhary et al. In 2006, Christensen and Su in 2013, and another paper by Evans and Tal in 2015. And so whilst there's lots of there's quite a lot of literature and evidence understanding around this particular health concern, it's not always understood. And so where there is a gap in healthcare professional and sort of areas of professionalism, the challenge is that apart from frontline healthcare professionals having limitations around their own time and time constraints, scientists' involvement at sort of face value in the case in the care of such patients, or those patients with this particular condition, or this with other sort of complexities, health complexities, then can can and should be involved, really. Modern healthcare is delivered by teams rather than individuals, and actually requires momentum of healthcare professionals from various disciplines, and that's actually quite nicely put in a paper by Weller and team in 2014. It is understood, though, that failures in professional integration and teamwork and sort of that collaborative or lack of collaborative effort can lead directly to compromised patient care and inefficiency. So that's been highlighted, and this is what causes anxieties no end, really, to healthcare scientists or scientists doing the tests and investigations, because that really is their primary objective. And whilst this is both beautiful and damning, because at the same time they are a professional. There are professional, and they have there's a professionalism around that, but there's also a skill set around that, and I'll talk about that in a bit. But the premise of how they learn the complexities of the science and the focuses around different sort of specialties, that takes a lot of time in training, and also a lot of time in ensuring that they can be the professionals who really do want to make sure patient care can be at its best. Professionalism in sort of integration is as much about smarter working as it is about professionals developing that sort of best practice and those efforts. There are multiple sort of routes where sort of retrospectively things could have interplayed, but there is this mindset or this sort of this sort of anxiety that if anything is sort of outside of that remit, then it's a problem. So there are sort of whilst there are sort of those sort of interfaces that can be used to actually provide patient care and dialogue, straight from the laboratory to patients, etc. The understanding around that is just not the sort of the challenges and the dilemma around that is that it has been that retrospectively hasn't fallen within the remit of the healthcare scientist's focus or role, more immediately, and so where there is this, there have been these problems or issues. There are multiple ways to develop novelty in practice, and sometimes it does require out of the box sort of contemplating, and there's more around that in the paper by Weller and team in 2014. Um, uh, so in this context, now I'm going to add, I don't really often talk about the economics and economy on this, on these kinds of things, but I thought I might as well put in some understanding about how to calibrate that. And it would be advantageous to underline if there is value for money where patients with long-term conditions like chronic kidney disease have access to sort of healthcare scientists in between healthcare sectors, if not in specific healthcare sectors, to support clinical or laboratory diagnosis and disease trends, especially wherein sort of other healthcare professionals may have incongruities relating to sort of the sort of terminology that is thrown around and kind of changed quite a lot. And there's a paper by Shaw and the team in 2013. Patient and public involvement actually on these in this context is still required, but I know from the work of for example, the Renal Patient Support Group or the RPSG have actually factored that in quite nicely, and the team around that have have interplayed and integrated some of that context with some of the publications and their resources. So I'm going to give I'll give a plain another example here. So for patients with chronic kidney disease, inclusion in a practice register was associated with increasing age, the male had a male dominance, diabetes, hypertension, cardiovascular disease, and basically around this there's this study that was done by a team in 2014, and they used data from 426 primary care practices in the UK and sort of standardized prevalence of stages between 3 and CKD stages 3 to 5, and basically they found that that robust sort of estimation of the prevalences between stages 3 CKD stages 3 and 5 uncovers significant misclassification and subsequent a suboptimal management of this particular long-term condition in primary care, and so what they highlighted, whilst they highlighted that context, the paper by Mohammed and team that was sort of a follow-up from 2020 sort of highlights that integration could bridge gaps where there is where healthcare scientists could be involved, because obviously there's various grades of this particular long-term conditions, but there's also various grades of healthcare scientists who could be involved. And for example, they're also in different areas of pathologies, apart from the different sort of healthcare scientists. You can have they're also clinical scientists, and normally part of their effort is also to deal with these incongruities around misclassification of particular sort of areas around this particular long-term condition, at least from biochemistry perspective, but in other areas as well, there are clinical scientists who actually focus on, making sure there's clarity in areas of practice more generally. And when they're at that particular level, for example, they're covered by the Royal College of Pathology, and so therefore they are known to have that knowledge base and do get involved. But sorry, when I mean get involved in multidisciplinary team meetings and efforts like that. But healthcare scientists and other grades, unfortunately, whilst there are scientists, healthcare scientists who are generally proactive in that context, unfortunately can, as part of their remit, they don't unfortunately get involved or can get involved in those multidisciplinary team meetings. So that's where it's a bit it's a bit of a sort of a rigid sort of structure around those areas of practice of practices. I'm now going to focus on a little bit around the skill mix side of things, sort of pinpointing on what I was saying about the healthcare educational aspect. Mostly all healthcare scientists are trained to have a good level of understanding and knowledge, understanding around how tests are requested, how to sort of validate and authorize, at least when at a certain grade and above. Validating and authorizing is part of that focus, and then being able to audit as well. Much like how we very much know about the, I'm sure listeners out there would know very well words like, track and trace, where apps being used to ensure that tracking and tracing, where if someone has COVID or COVID-19 symptoms, that using the app, an app apparently can help identify if another person can contract the symptoms, and if that's the case, then if they've been in that same place, then they'd have to they'd have a thing that comes up on their app to say that they have to isolate now, isolate or have to go into shielding or whatever. So anyway, apart from that, as an example, auditing is kind of like a track and trace situation, where in laboratory practices, laboratory audits are done to ensure that if there are any ambiguities in areas of testing and investigation, that those tests can be audited, and even to the point where the costings can be compared between one manufacturer versus another manufacturer of these tests and investigations. So thus audits can actually be used to save money as well. Ultimately, audits are also used to implement and ensure that practices are not sort of outside of what's been documented as part of standard operating procedures, and that also is important where quality assurance is concerned. So what is presently sort of witnessed though, or kind of observed really in most NHS National Health Service laboratories sort of today is a systematic sort of reprofiling of skill mix in the laboratory, and most laboratories are now employing more support staff, and that includes sort of lab assistants and associate practitioners, in preference really to healthcare scientists who are trained to apply skill base across pathology. And by the by, I would say that laboratory assistants and associate practitioners have their place in laboratory practice. Some of them are far more intelligent and smart than actually the scientists, and these generally though, the professionals have, I mean, generally sciences, or the healthcare sciences, has been downsized, and there's a report by the for example by the Institute of Biomedical Sciences between 2015 and 18 that highlight that this in some context, and sciences generally is not unheard of, for example, that there's consolidation in areas of practice, and this means that there are now more issues relating to, or there have been issues relating to staff cover, time delays, access to more qualified staff, processes being compromised, more risk management, and sort of more general culture and realignment issues. And so less experienced or lower sort of caliber staff are also to be respected, and are also there to ensure that there's continuity, and to carry out tasks and areas of practices that they should also be they should also be appreciated for. They're certified. For example, associate practitioners and laboratory assistants can and should work towards sort of those qualifications, where they can become more apart from being more experienced, but can be licensed and certified and trained to perform sort of those more scientific focuses, and so the skill set, or the skill mix, there is a standardized way. There's a standardization. The standardization between scientists and healthcare professionals. Laboratory medical laboratory assistants and or associate practitioners, because at the end of the day, we all scientists have to work across those sort of standard operating procedures. But then obviously there can be so sort of what I'm saying, what I like to say is there is a way to separate that a bit more, and it's about those sort of senior healthcare scientists or health professionals actually having an educational focus into areas of practice, and so and as I mentioned, there's MS Teams, and there's opportunity to Zoom calls, etc. So that is something that healthcare scientists could be doing directly from the laboratory, in laboratory. And actually, what would be good, it hasn't been discussed as yet, listeners, but in one way or another, if there was healthcare scientists who can give sort of that educational support to members of the public, maybe through a MS Team or Zoom call type facility, that actually those people in the general public can actually see what a laboratory looks like, and they won't even have to step in the laboratory. So things like being worried about getting contaminated, or having some sort of viral infection, or all of those kinds of things, bloodborne illnesses, and all of these kinds of things that you hear that scientists keep in fridges, and in those walk-in fridges and things like that. Those from the general public, if they're kind of in on an MS Teams or Zoom call to get an understanding around educational support, they don't have to worry about getting any of that. So the healthcare sciences play sort of a key role in that, in sort of diagnosis, such as in various diseases, diagnosis of various diseases. So some of those I want to just delve into a bit more, such as, for example, anemia, diabetes, malignancies, sort of cancer malignancies, benign and malignant and benign cancer, sort of focus around emergency blood transfusion, meningitis, hepatitis, chronic liver disease, chronic kidney disease, hematological malignancies. All of these things are, generally people can have these things. The general public can have these things, and it's up to the scientists really to bring that out into the where understanding is concerned. And actually doing those kinds of things are actually a little bit about what the renal patient support group has been doing, as I've gone through some of the context, and actually that sort of understanding is really where different healthcare scientists from different disciplines can be involved, more so. But the RPSG has been doing that, sort of really quite succinctly, really, from sort of a kidney care practice perspective, and doing those sort of webinars, etc., as well. So that sort of practice can and has and should be implemented in actual sort of laboratory spaces, as well. So advocates that the UK Department of Health and Institute of Biomedical Sciences, they advocate that patient safety must always underpin the modernisation of careers in healthcare science, despite emphasis on competitiveness and cost efficiency advocated by the National Reviews of Pathology. So the Institute of Biomedical Sciences, as I've come to know and understood, they have highlighted that it's important to maintain a robust sort of relationship between laboratory workload and healthcare professionals, or healthcare professionalism. And so so that's where there's, as I mentioned, there's this focus around the professional bodies and Institute of Biomedical Sciences. One of them, there's this general anxiety where there's a skill set or a volume or understanding where healthcare scientists do that sort of work, but in where they should be, where there should be cover or coverage for example, around areas around focus around where insurance and indemnity should cover, especially with educational understanding, that doesn't really fall within the remit, unfortunately. So, given that most laboratories have now become automated, and routine tasks are now undertaken by sort of support staff and delegated to sort of broader allied health professionals in one way or another, the knowledge and skill base sort of healthcare scientists sort of acquire through training become specialized or advanced in healthcare delivery that actually extend beyond the core of their training for given areas of practice, and that's actually been highlighted by McCann and team in 2013. Skill set required by healthcare workforce change depending upon needs and demands and this also includes things like sort of diversification or diversifying, and so and I won't go into much more around that, but there is a report by the Department of Health that sort of focus around areas of sort of healthcare workforce or workforce, and there is a other paper by De Silva in 2011, and there is NHS England report in 2015, and there's more literature out there in that focus on those on skill set and skill mix. I'm now going to focus just on quickly around put a little bit of sort of emphasis on sort of barriers to integration. I've mentioned a few, and there is a few more things I'm gonna add here though. Several health professional bodies worldwide have become have come out of recent statements to define roles and the characteristics of a successful team. Bellow and team in 2019 highlight some of that context. Patients sort of whether sort of involved or semi-involved or kind of even blasé about aspects of their healthcare, undoubtedly at the same time there's a mutual focus where generally they are interested or intrigued in self-care and must be part of and find themselves sort of being part of communications processes, or should be at least finding themselves in part of sort of bi-directional communication, and early involvement around that has been also shown to minimize errors and potential adverse events. There is this misconception though around certain disease and long-term conditions, and these conditions can induce further anxiety and stigmatizing for patients, patients generally could benefit from one-to-one sort of educational support with sort of those scientists who have that understanding, and to provide to provide understanding of certain disease trends. There's a paper by, apart from Bellow in 2019, there's a bit of an older paper by Grinson and team in 2010, and that's actually is also quite a good one. Professional integration could sort of enhance or advance the patient's access to resource as well. With new healthcare initiatives on the horizon, facilities could be utilized further, allowing to have more involvement based on community requirement. Healthcare scientists sort of have to become acquainted with those areas of where there's obvious inequity, for example, to ensure services are integrated, supporting patients who require support, first and foremost, and with the most need. And there's a paper by Giardina and team in 2018 that sort of highlights around looking at focuses around professionalism and integration. It is responsibility of actually scientists, whether they're in laboratory practices or outside the laboratory practice, to actually provide public with new knowledge. That's actually a paper. It's actually an Italian author, Vincenzo and team in 2016, who highlight that the sort of premise and foundation of what the scientists are when it comes to providing healthcare expertise without being healthcare expertise to the public without being involved in sort of public policy. And at present, healthcare scientists are not integrated into the sort of educational support, and that sort of needs to still come back, sort of 360 back into healthcare. So in that context, some of the strategies to overcome barriers have been summarized again in a paper by Bello and team in 2019, and there are other authors that have highlighted similar work, similar understanding. So they can include teaching, sort of bring about more effective communication, having sort of training meetings that are sort of integrative, and using simulation can be helpful. In laboratory practice it is done, but it's done from the side where an engineer, for example, can guide scientists or technicians through a dilemma, if it cannot be done, if for example an engineer can't get down to the laboratory, for example, also apart from simulation, there's another barrier can be defining inclusivity, and what that really kind of means, in relating to science and laboratory practice, albeit the paper by Mohammed in 2020 highlighted some of that, having organizational and cultural organization and cultural support within laboratory practice, where there is sort of a health, and there is sort of that sense of camaraderie that can be brought into that can, if there isn't that, then that can be a barrier to integration. So opening up those sort of barriers can actually help prompt and encourage interprofessional collaborations as well. So just a quick overview in relating to bringing all the context together, sort of a critical analysis. So patients seek understanding of laboratory tests and investigations or information through online, and that can be through search engine, doing searches through search engines, using online support groups, using apps if need be, apps and technology, and there are websites as well, and often more often than not, most of these things are non-evidence based. Obviously they would claim to be evidence based, but they are more often are not. So there is a paper by Fryer and I think it's Fryer and Smelly in 2013, and health literacy is and can be a barrier, and studies inform that online portals are not currently or have not been designed really to present test results to patients in a meaningful way, and work by there's a few authors that have highlighted some context around that. That being said, the renal patient support group team, there is an information portal page which an educational portal page which highlights different paper publications from various authors under different themes relating to chronic kidney disease, and those are evidence-based paper publications in the majority. And so our PSG team have kept up to date with kept evidence-based practice up to date with in that regard. So I think this that from an analysis perspective, that is really where patients and the public and anyone who anyone doing those sorts of works around other specialties, other different areas of healthcare, should look to potentially look to the work around the renal patient support group. Only that so that if there are papers that other researchers and investigators and even healthcare scientists have come across, or looking to looking to develop sort of those sorts of focuses around different other healthcare conditions, that in future perhaps there could be more online support groups, or if there are online support groups with that have sort of a website or web sort of a portal, that they can include themes around different areas and conditions around the main one. So if it's around I don't know, for example, an area around an area around um, um, uh, blood transfusions, or yeah, actually blood and maybe blood and organ donation, for example, or blood and organs, for example. Then wherever there is a focus around that there is evidence-based literature to highlight different authors, and there are themed folders around those works, so thus to bring that understanding to the general public and in layman's. And still being evidence based. So that's an important point to make here. Patients still want obviously want more face-to-face understanding of tests and results, at least in one way or another, and so that they are getting more rounded care. And that's been highlighted by Pillamere and team in 2016, Christensen and Sue in 2013, and Mack and team in 2015. And so the final point around the sort of analysis around this audio podcast here would be for me to say that there is more scope actually where scientists can be professionally integrated into between healthcare sectors. There is the resources to do that, or there is resource at least. There is facility resources around that to do that, to support best practice, bringing service for patients with different conditions, sort of keeping in sort of helping patients to bring to ensure that they have the appropriate understanding at the right time. And so that's where I'm going to end this audio and podcast. I'm sorry it's been a bit lengthy, but it's been a while since the last one, and this has been part of series 4, the Shientist, and it's been great talking about this subject matter, and this has been another Ztorm Lobostics production, and this was Rudimentary Ztorm, the Immunocomplexities of Calibrations. Thank you for listening out. Take care.